Okay, welcome back everyone from the break. And we are now going to shift to our concluding panel discussion, which our workshop moderators will summarize the key themes from their sessions and discuss their recommendations for improving inclusion of older adults across the drug development continuum. So I would like to welcome and turn this over to our two moderators, Larissa Nekledov and Gwen Darian.
Thank you, Monica. It's great to be here with you today. I hope you enjoyed the prior three sessions that we've had already together. So I am Larissa Nekledov. I'm a general internist and a cancer survivorship-focused physician at the Brigham and Women's Hospital and Dana-Farber Cancer Institute. And I'm joined today by my co-moderator, Gwen Darian, who is Executive Vice President of Patient Advocacy and Engagement at the National Patient Advocate Foundation. And as Monica mentioned, we are very pleased to moderate this final session of the workshop. So the goal for this session is to synthesize the information that has been presented in the prior 4 sessions and to move forward to outline the recommendations for the future in this area. So each of the session moderators will provide us with a very brief summary of what was presented at their sessions and outline proposed solutions. We will then have an opportunity to have an interactive discussion and also include the audience in this as well. So to start, the moderators of sessions 1 through 4 will have 10 minutes per session for a brief summary of key messages from their sessions, and this will be then followed by a group discussion. So I will only briefly introduce the session moderators. You can refer to the full bios in the online briefing book that is available. So for session 1, it's going to be Harpreet Singh from the Food and Drug Administration and Heidi Kleppen from Wake Forest School of Medicine. For session 2 is Shwarya Subbiah, University of Texas, MD Anderson Cancer Center, and Donald Harvey from Emory University School of Medicine. For session 3, we will hear from Monica Bertagnoli at the Brigham and Women's Hospital and Dana-Farber Cancer Institute and Eric Rubin from Merck Research Laboratories. And finally, for session 4, we will hear from Randall Oyer, Lancaster General Penn Medicine, and Rich Szulski from ASCO. So I'm really looking forward to this discussion and coming closer to the actionable next steps.